Welcome to JAT Chat, presented by the Journal of Athletic Training, the official journal of the National Athletic Trainers Association. I'm Dr. Radzak, an associate professor at the University of Nevada, Las Vegas, and your host for today. I am joined by Dr. Sean Rogers and Dr. Amanda Tritsch, who are part of the team who developed a series of articles and editorials addressing the role of athletic trainers in providing care for transgendered athletes and gender diverse patients in the Journal of Athletic Training's recent special issue. Dr. Sean Rogers is an associate professor and coordinator of clinical education for the Athletic Training and Health Sciences program at Drake University. And Dr. Amanda Tritsch is an associate professor, program director for the Professional Athletic Training program, and associate director of the School of Physical Therapy and Rehabilitation Sciences at the University of South Florida. Sean and Amanda, thank you so much for joining me today.
Thanks for having us.
Yeah, thanks for having us.
So the first thing that I want to ask you guys is, can you give us a little bit of background information of how did this two-part series and the associated editorials kind of come to be?
Yeah, so I would say over the last sort of decade or so, there's been a lot more research within our profession specifically about how we could best provide equitable and high quality care to patients of all gender identities and sexual orientations. And this kind of spawned when some members of the NATA's LGBTQ plus advisory committee, and as well as some of the professionals that we've worked with and done research with, really wanted to kind of pull together all the information that has been published within our profession to try and define what the role of an athletic trainer is to do just that, equitably support and care for transgender and ungendered. So we're really fortunate to have had a two-part narrative literature review published in the JAT, and really excited to use this opportunity to provide some context around these two articles and what athletic trainers need to know in order to provide the equitable care in addition to what we publish.
Thanks. And Amanda, you were on the editorial team. So what is that one covering and how does it interact with these other publications?
The proposed editorial that we had was to kind of give some additional clinical context and less of a scientific delivery, but some additional information that we thought would be beneficial for clinicians and colleagues to have regarding different treatment opportunities with these patients that just didn't quite fit necessarily into part one or part two of the series.
So what should readers expect in part one? What is that part one covering?
Yeah, so part one really offers readers kind of a foundational understanding of everything that needs to be known when providing care to transgender and gender diverse athletes. Everything from the gender affirmation process, the multifaceted process in which individuals may choose to kind of pursue in order to support and affirm their gender identity. And then also providing some foundational information on things like terminology, how we develop in our professional care teams, and who should be included.
So what would be some good first steps? Like, how can athletic trainers be sure they're using gender inclusive terminology and language?
I think there's a couple real direct and kind of more easy opportunities that we have when interacting with all folks, not necessarily our patients, but just all folks around us. One of the things we can pretty readily do is when we introduce ourselves with our pronouns, and then give the people that we're interacting with an opportunity to provide us with the pronouns that they use as well. That takes any guesswork out of how we're referring to folks after that point. Now we're in the know, and it also allows folks to give us their name that they would like to go by, which is kind of what we do in all interactions that we have with all people. I think another pretty straightforward thing on the documentation side of things is just ensure we always have a way and an opportunity for people to provide their pronouns and to provide the name that they go by, which again is something that we do quite often. If we have somebody that chooses to use their middle name to be referred to in context, we want to know that and we want to document appropriately for those patients. This is the very same. So it's not any different than the way that we continue to interact with all the folks around us.
I would like to add to that too. When we think about things like using appropriate pronouns and using the name that someone goes by, every single one of us expects that respect. So really just to hit that point home, if you were engaging with anyone else at work, at a bar, at a restaurant, you shared your name, and continuously the individuals use the wrong name, right? That would cause some hurt. That would cause a lot of bit of discomfort. And unfortunately, when we talk about this population, the idea of something as simple as using someone's name and pronouns have become so incredibly politicized that really, just to highlight what Amanda said, it's really not that complicated. We really just need to do that same thing that we do for all patients, offer that level of respect.
That's perfect. So, another aspect that you guys discuss is just interdisciplinary care, right? Which is so necessary for every single patient, but in particular with transgender and gender diverse group, what should we be thinking about as far as facilitating this interprofessional care for this group?
Yeah. So as athletic trainers, one of the things that we put in the article and we firmly believe is that the role of the athletic trainer when caring for transgender and gender diverse patients is to be able to develop that interprofessional care team. As you had mentioned, important for any athlete, but especially when we look at patients who maybe want to undergo or continue things like gender affirming hormone therapy, or maybe they want to pursue gender affirming surgery. We're going to need to be able to locate qualified professionals within our area that we can refer those patients to, who are also specifically trained to work with this patient population and have a proven track record of providing that equitable care. So, as an athletic trainer, being able to proactively identify those individuals, whether those are plastic surgeons, endocrinologists, and pharmacists, is incredibly important. And part two of this narrative literature review actually dives into that a lot more to help athletic trainers interface with those individuals in that interprofessional care team that maybe they might not have a lot of experience interfacing with in their typical patient base.
What are some other key areas that you guys cover in part one?
So, in addition to developing that interprofessional care team, which we promote as one of the main roles of the athletic trainer, the two other roles that we kind of focus on is this idea of maintaining an inclusive environment for all of our patients so that everyone can thrive together. And then making sure that athletic trainers understand that being knowledgeable about all the information in here is incredibly important to offer that high level standard of care. So, from an inclusive clinic standpoint, I think that we could start there. Making sure that your clinic and everyone who operates within that, whether those be athletic trainers, other healthcare providers, has that foundational training, maybe something like safe space ally training, maybe other certificate trainings, but has that foundational training to be able to communicate in an inclusive manner, using those appropriate names and pronouns, having some of the foundational information, which we've conveniently put in these articles for you. Other ways that we can focus on making that inclusive clinic is things like putting up signifier stickers that this is a safe place, making sure that some of our patient materials, such as brochures, are inclusive of multiple different ranges of healthcare conditions. They show and they depict multiple different individuals of different genders, sexual orientations, just a few ways. Amanda, if I could toss it to you, any other ways?
Yeah, I think that in addition to all the things that Sean has touched on, something that's important to remember is that all folks may face some health disparities that vary from their peers, and this population potentially, or not potentially, definitely is no different. Just might have some different considerations to take into account. On the mental health side, we want to make sure that we also include some mental health resources and expand our interprofessional group to those folks as well. Trans and gender diverse folks may experience physical or emotional violence in ways that other of our patients may not, just due to some of society and cultural things that are happening in the world today. And that might put these folks at a higher risk for need for mental health resources. So we want to make sure that we're aware of those as well, and have the ability to provide those to our patients if the need arises.
So as we close out here, I just want to hear from you guys. What are some of the big takeaway messages? What do you hope a reader of these publications gets out of it?
Speaking for myself, I hope that an athletic trainer at any level of understanding or knowledge can go into this and get a good understanding when they provide care to a transgender or gender diverse athlete. They have that foundational information they need. In no way is this going to answer every question that they have. It's no way is it going to provide every ounce of information that they will need, but it'll give them that starting that they can understand, to build off of, and to help improve that care, and hopefully maybe provide some ideas of things to proactively do.
Yet along those lines, my hope is that having these articles out there for our colleagues to read takes away some of that I don't know what to do because I don't know what to do, and provides some answers, provides some resources, provides some information where we might not have had it easily accessible within our profession in the past. So now it's there. We take away that excuse of not knowing what to do because we don't have access to the information. We're providing some of that information with folks and giving folks the ability to find additional information if they would like to.
Perfect. Thank you guys so much. And just a reminder for everyone listening, this is available free of cost through the Journal of Athletic Training, open access, as is all of the Journal of Athletic Training's offerings. Thank you all for joining me today.
Thanks, Kara.